Hi, I'm Janice Gray with DTA, and I wanted to share with you some of the outcomes that have been achieved by using this modality of care team coaching. Now, you may know care team coaching is provider coaching or shadow coaching or physician coaching. Care team coaching is just what we call it here at DTA because we do it with care team members across the entire continuum of healthcare, not just with physicians or other providers. Now, some of the outcomes are truly quite remarkable. I always find that people are looking for a silver bullet in patient experience improvement, and care team coaching is one of the closest things to that I personally have ever seen in the last decade that I've been working in patient experience. During that time, I've had the opportunity to personally coach hundreds of care team members and observe them in literally thousands of patient and family interactions. What we find is that the outcomes are consistently improving no matter which organization we work with. So for example, the very first time I ever did care team coaching was with a group of 75 hospitalists in a large health system. We were able to measure their HCAHPS data at the physician level in that organization, and we were able to track their improvement. In a span of 9 months, they improved 10 times the national rate of improvement for the HCAHPS physician communication composite. If you're familiar with any work within HCAHPS and within physician communication, you know that nationally, that is the composite that has lagged and has moved very, very little over the last 10 plus years of public reporting that's been available for HCAHPS. Other organizations have measured different metrics within their patient experience. One organization that we worked with has a hospitalist-specific survey that they ask their patients as part of their follow-up process. In that group, they saw the hospitalist improve in 90 percentiles worth of improvement on that patient experience survey. This doesn't just apply to hospitalists. We've seen this all across, whether it's clinics and CGCAHPS. We've seen it across all sorts of different metrics that people are measuring, be it nursing communication or other modalities and aspects within the patient experience surveys. The other part of the outcomes that I think are really important are on a personal level with the person who's being coached. Quite honestly, I've made more than a few people cry when I'm giving them the debrief and the feedback about their performance. And it's not sad tears, they're happy tears. As one emergency room physician said to me through her tears, she said, "Janice, we never hear the good stuff." And so she was just completely overwhelmed by the amount of positive feedback that she was receiving during our coaching session. The other thing I have to say is that I have never seen a modality have more of a quick impact on improvement in communication. Quick story. I was coaching with a physician one day and we debriefed after the morning together. And one of the things I told her that she should work on was the use of open-ended questions. So instead of saying, "Do you have any questions?" making it open-ended and saying, "What questions do you have for me?" We debriefed. It was about noon. This physician went on and went about her afternoon. And at about 6 o'clock that night, I got an email from her. She said, "Janice, my patients have questions." And she's like, "I tried what you said and I just put a what in there." And I started asking, "What questions do you have for me?" And suddenly I was getting all the questions out in the moment. She said, "It's not like before when I said, 'Do you have any questions?' and they said no. And then I left the room. And then a few minutes later, they finally thought of one. And then they talked to their nurse and the nurse had to page me. And then I had to call back and then I had to answer the question through the nurse." She's like, "No, this was so much more efficient. All I did was change one word and it made such a difference." That's the type of real-time improvement and behavior changes that I'm talking about that we see in care team coaching. That's why I love it as a modality and why I think it's so effective for organizations to use to improve their communication with patients and families.